often it blows our patients away because they will come in and maybe it's just wellness. They're feeling pretty good, but they come in every month just in case. And I will check them and I'll say, you're good today. Go forth and be good. And they're like, what do you mean? You're not going to adjust me today? Your body doesn't need it. And so I'm not going to do something to you that you don't absolutely need. I want to do the least to you to get the most for you.
Yeah.
And I'm going to do it in such a manner that it's very safe. It's very repeatable. And it is something that, again, is not my idea. I would implore you to ask my wife. She'll tell you I don't have good ideas a lot of times. So it shouldn't be my idea and it shouldn't be your idea and it shouldn't be, any doctor's idea. We should be measuring and we should be finding out the problem. But I can speak to the Gonstead method because that's how I got fixed. So going from a traumatic back injury where I couldn't use my right leg for a very long time to not having any pain or issues or range of motion or mobility issues to where I feel much better now than I did way back then. It worked for me. And that's what it was, is I accidentally, literally found a Gonstead doctor that understood the problem, found the problem, fixed the problem, and then left me alone to heal. And that blew me away to the point where I was like, okay, I'm going to go and do this thing. And his advice, which thank God he gave me that advice, was your first day going to school, get involved with the Gonstead community because you're going to practice. You're going to practice till you can't see straight and you're going to think you suck at it. And you're going to have to work harder than you've ever worked in your life. But when you get proficient at it, when you get finally good at it enough to help somebody, when somebody walks in with a very serious problem in their eyes and you can help them right away and they see the results right away, you become something different to them.
Yeah.
I have one of our great patients. I love them to death, but the whole family, the matriarch came in years ago and she woke up one day with facial drooping. Bells-Palsy. And they are a family that doesn't lean into a lot of medicine. They're more natural, which is fantastic. I mean, I'm married to a pharmacist, a clinical pharmacist. Both my parents are retired nurses. I know there's a lot of importance in the medical community and in pharmacology, but there's a time and place for it, just like with chiropractic, time and place for it. So her husband and her came in and she was besides herself, and because she had gone to a med place like an urgent care or something, and they said, oh, Bell's palsy, it's a virus. It could take 6 months to a year to resolve. And so this lady's thinking like she's going to have this facial paralysis and these other issues for a very long time. And to be honest, I don't know how she found us. And, when you first have these patients come in.
Yeah, especially a legitimate problem.
This lady came in and I was a new doctor at the time, newish doctor at the time. And she has facial paralysis, right? And I know from my training with the Gonstead community, from teaching, from all those things that we can help with this, that sometimes it is a virus, but sometimes it is not a virus. Sometimes it's compression on the cortical tracts in the spinal canal, right? On the spinal cord itself. And so although I wasn't shaking on the outside, I was nice and calm. I was shaking on the inside because I was like, oh my God, I've never had this type of, I've had the back pain, neck pain, headaches, standard stuff, but this was the first, gut check, the pucker effect. Yes. It was the pucker effect was on, let me tell you. And so I did all of my analysis. I went through all the 5 steps. I calmed myself down. I studied everything. So I found that this patient, her Atlas C1 was misaligned. Now she had some other things too. But as far as the primary culprit, I found that Atlas was misaligned in a particular way. And so I used that analysis to determine that. And then I used my skill set that I learned on how to set up on it or how to approach that to free that joint up, to take the pressure off the neurology. And that's all I did. And I said, okay, we're just going to do this today. And I'm going to send you home. And I want you to just relax for the next couple of days. And I want you to come in like 3-4 days. And let's recheck it. And there may not be. Okay. And I prepped her, hey, this may help a little and it may not help, right? We'll see. But she was pretty positive it wasn't a virus, as I did as well. And so she came in, she didn't wait 3 days, as a matter of fact. The next day I was just about ready to leave and she walks in with her husband and the husband has tears in his eyes. And I look at her and she doesn't have facial paralysis. Now, there was still a little bit of like maybe drooping underneath the eye a little bit or whatever, but like she was smiling, a full smile, know? And I said, oh, I see that we've got some good results from that. And she burst into tears.